I am so excited to be here, and it's been fun to watch people coming on to say hello. A lot of us haven't seen each other. I'm Sherry Wells, and I'm the Executive Director for the American Heart Association of New Mexico. I am excited to be able to offer the second in our series of mental wellness that is being sponsored by Bank of America and Merrill Lynch. And you're going to get to hear from their two market leaders, Paul Mondragon and Elaine Darnell, shortly to talk about why this is an important topic, why they want to be sharing information to other business leaders in our community, and then some of their own best practices. And then after that, we'll be hearing from our three conversationalists, and we call them that because we want this to be interactive, and we would like for you to feel free to put questions in the chat box. You'll be muted, but you can put your questions in the chat box, and we will have time at the end for more questions. But again, this is give and take, and feel free to be chatting to us while we're talking. So you're going to hear from three business and community leaders, and they're going to be talking about how they are bringing back their employees, their staffs, their teams. Some are doing different situations. Some are doing, hybrid situations. They'll talk a little bit about some of the challenges and then the best practices that they're experiencing. And I know everywhere I go and all the people that I talk to, this is very challenging, and we're all looking for ideas and affirmation that maybe we're doing it correctly, or here's another idea. So look forward to hearing from all five business and community leaders. Next slide, Taylor. And then next slide, please. So I'm going to just tell you really quickly why American Heart Association is so vested in mental wellness and mental health as it relates to heart disease. It's extremely important. 1 in 3 people experience depression, and I'm guessing that maybe that number could be increasing since the pandemic and coming out of the pandemic. And for those of us that are not sure what the next step looks like, and I know that here in New Mexico, we were mandated to wearing masks again yesterday and indoors, and there's stress around that, and what does that look like, and is that going to change how you're bringing back your employees? Next slide. So there's a real scientific, and everything that American Heart does is based on science and research, being the largest nonprofit healthcare agency organization in our country. But the connection between the mind, heart, and body connection, it's very well researched, and this particular slide gives you some of those demographics. I think this is also, these demographics are making it why it's easier, and I know you'll hear from one of our conversationalists, probably all three, why they're making the environment in their office and in their workplace throughout, whether it's office or still virtual, why they're making it, they're taking away the stigma of being able to talk about mental health and struggles. Next slide. And again, we're very, very focused at American Heart. Our 2024 impact goals include health equity, and mental well-being is very definitely a part of health equity issues. Next slide. Again, welcome to the community conversation sponsored by Bank of America and Merrill Lynch. And next slide, Taylor, where I'd like to introduce Paul Mondragon, the New Mexico Market President for Bank of America, and then he will introduce and bring in his counterpart here, Elaine Darnell with Merrill Lynch. So Paul.
Thank you, Sherry. As Sherry said, I'm Paul Mondragon, President of Bank of America, New Mexico, and I'm honored today that Bank of America and Merrill offices in New Mexico have joined together to sponsor today's important discussion. Mental health has become one of the most talked about challenges for Americans within the last year. And in New Mexico, we identified it as a key issue in a community roundtable with local leaders. At Bank of America and Merrill, we chose to join the American Heart Association of New Mexico as the mental wellness sponsor because we are committed to the health and wellness of our teammates and the communities that we serve. When we eventually exit the crisis of the pandemic, mental health issues will be a burden on people for years to come. How leaders support their communities and how employers support their employees is critical. It will affect job retention and attraction and filter into every aspect of people's lives. Core to making B of A a great place to work is our ongoing investment in our employees' physical and mental well-being. Like many companies, we enhanced and expanded programs to help our teammates access mental health resources, as well as continue to do so and we will continue to do so as the face of the pandemic changes. We will lead by example, participate in community dialogues such as this, and share perspectives on the steps we are taking to support our employees' mental health. Now I'll pass it over to my colleague, Elaine Darnell, Market Executive for Merrill in New Mexico and El Paso, who will share what we have done around our return to office. Elaine?
Thank you, Paul, and good afternoon, everyone. I am very excited to join this important conversation on mental health and well-being today. By way of a quick background, on March 20th of last year, we transitioned 95% of our roughly 130 associates in the market to a work from home posture. The vast majority had never worked remotely, and while we needed to focus on continuing to serve our clients, and we spent time delivering technology and training resources, we also recognized the strain and stress our teammates were dealing with. Personally and professionally, there was fear, anxiety, loneliness, isolation, and uncertainty. My team and I recognized that we needed to operate differently, to make sure that our people knew of all the resources our firm was providing, and to make sure that they felt our support and appreciation. We began to over-communicate with our people and built out daily, weekly, monthly communication routines to stay connected, deliver updates, information, and training. I'm so proud of the response by Bank of America Merrill in our communities, as well as the support of our people. Beginning in June of this year, we began to bring our associates back to the office. Currently, we have approximately 70% of our associates working in the office. And really, the strong feedback from our teammates has been important in our approach and shaped many of the decisions we've made in this return. We continue to support our associates in the office as well as at home with the tools and resources they need to be successful, as well as providing opportunities to solicit feedback and deliver dedicated communications and support. Based on guidance from the CDC, we've worked to limit the risk and exposure to support our teammates' physical wellness. For teammates working in the office, we've provided a daily health assessment screening, temperature checks, we've conducted enhanced workplace cleanings, provided each employee health and safety supplies, and installed wellness barriers. We're providing PPE in our offices and have sent 2 rounds of face masks to every associate's home to help protect them and their families. As Paul mentioned, we provide ongoing access to our comprehensive benefits and resources, many of which have been expanded in response to the pandemic, including no-cost coronavirus testing and enhanced backup childcare and adult care services. These are just a few of the ways we're supporting our team as they work from home and transition back into the office. It is an honor to be a part of Bank of America Merrill, a leading organization committed to addressing this pandemic and the related strain of mental health by bringing resources to our community. Thank you again for joining us for this important conversation. And I'll pass it back to Sherry for an introduction of our conversationalist. Sherry.
Thank you, Paul. Thank you, Elaine. Every time I listen to the work and the strategies that Bank of America and Merrill are doing, it just is amazing to me. I was wondering, are you talking about this as you're hiring people? Is it potentially a way to hire? You know, they say it's hard to hire people right now, hard to even find people. But I'm thinking, what a great way to show prospective employees kind of the behind the scenes, the bigger picture of why working for your organization would be beneficial.
Certainly, Sherry, I'll just jump in here and say that we've hired a number of associates that have never been in a Merrill office. They were completely work from home right from the get-go. So we were delivering technology to their homes. We were talking about, you know, how we support our associates. So I do feel like it was a difference maker for us as we, you know, obviously looking to add top talent, but in this environment where there was all this uncertainty.
Yeah, okay. Thank you for sharing that. Okay, next slide, Taylor. Okay, so now we are going to start with our first conversationalist. Ben Thomas is the president and CEO of Sutton Fair & Brown. And I'm going to just turn it directly over to Ben because he has some great information and conversations to share. Ben?
Thank you. Thank you very much, Sherry. I want to thank the American Heart Association for having me speak, and I'm excited to hear from all the conversationalists today. But maybe what I'm most excited about is finally, for the first time in 18 months, I get to talk about something other than legal compliance with the COVID laws or vaccines or recreational marijuana in the workplace. So this is actually near and dear to my heart. The legal profession has had a long history of struggles with mental health issues, and we're very cognizant of that in our profession and at our firm. So this is something that I absolutely would love to talk about, and that our firm has taken very serious. What I'll talk about real quickly is I'll give you guys an idea a little bit of where we are in our firm and our transition. I think what you'll hear is that all the businesses are kind of in different places, and we all may be in different stages of our return to work or our remote working situation. And then I'll tell you a couple major lessons that we've learned during the pandemic that have, we hope, helped with our employees' mental health and well-being, and we plan to use those going forward. And those are really communication and connectivity. My firm is, as of now, almost entirely back to work physically. We have a few exceptions to that being some folks, particularly lawyers, that may have childcare issues or may have health concerns about being back in the workplace. And that's kind of a point I want to make right away, which is, as an employment lawyer and as a business owner, we've traditionally always seen the workplace as black and white. You have your 8 to 5 job, you get your 1 hour lunch at 12. We know that that's not the case anymore. The world doesn't work that way anymore. It is no longer a black and white office space. And I think you've got to take your employees' individual circumstances into consideration when you're looking at it. I think it's, as Jimmy Johnson once said, you treat everyone fairly, but you don't have to treat everyone the same. And we've really learned that because everyone has different trigger points for their mental health and well-being in their life, whether it's caring for a family member, whether it's their own health, whether it's small school-age children. These are things that I think during the pandemic, we all realized we have to take into consideration. And I think that is something we look at going forward. Along those same lines, when we first went remote, as things began to loosen and as we were able to come back into the workplace, we developed a hybrid and a slow workplace transition in line with the governor's health orders. And the reason we did that was we found that an immediate return to work for some of us was challenging, to say the least. I'll use myself as an example. My wife and I both work full time. We have small school-age children. Again, everyone has their unique stressors and trigger points. And my primary help for taking care of my children when they're not in school is my mother, who happened to have just about every box checked on at-risk factors for COVID. So we had to be really careful. And so, we had to really slow our transition into the workplace until I could get everyone fully vaccinated in my family. And my first week back in the office, I felt like I ran a marathon every day because my body and my mind were not accustomed to being back. And my HR director had the same experience. So we really implemented, as we brought people back, a much slower transition. We started in the middle of the week, right? So we could get them to the weekend and they could rest. And then we did a hybrid schedule for a long period of time where they were working some remote and some in the office. And now I think it's sometime in July, we went fully back 100% of the office with the few exceptions that we have to make. And that has worked so far. And that has worked well for us. And we found that to be a positive transition. And the other element of that I want to talk about that has been really helpful for us was the idea of communication with our employees. Early on in the pandemic, once we were able to have some small physical presence in the workspace, which for a law office was so valuable because filing things and getting things done remotely was almost impossible. I was in the office one day and the employee that had volunteered to be present told me that she was very thankful of firm management for our level of communication. And I didn't quite understand what she meant. And I asked, and she said, look, None of us know what's going on. We're all terrified. We're terrified we're going to lose our jobs. They didn't. They were terrified of getting COVID. Nobody knew what was going on. And she said, thank you for just keeping constant contact with us, because it's one less thing we have to worry about. And it really got me thinking that all of us were going through some level of anxiety, some level of those stressors that trigger mental health concerns during the pandemic. And if we as employers can remove just a piece of that by communicating, or even over communicating, as Elaine said, with our employees, that takes away one less step or one less issue of potential anxiety. So our board of directors began meeting every week. We don't normally meet but once a month. We met every week. We tried to set out a plan for the next 6 weeks. Obviously that changed all the time because things changed all the time. And then we communicate that plan to our staff. And what I have found now that we're back in the office is that same communication needs to continue to happen going forward. That communication is invaluable to the employees. So we're trying to take our pandemic level of over communication and apply that as we go forward, because we think, again, it helps our employees. Just because our employees are coming back to the office doesn't mean that they're no longer struggling with some of these anxieties and some of these mental health concerns. Just because they're physically present doesn't mean everything's solved. So I think if you continue to over communicate and keep them informed, that will at least reduce some of those stressors. The other element we found was the connectivity, right? Keeping us together even when we're apart. We all know that a lot of mental health issues are triggered by isolation, lack of human interaction, lack of social interaction. That was all of us, right? In March and April, we were all isolated, and it was hard on everyone. And again, mental health is something that's at the forefront of my mind because of our profession and our profession's struggles. So, early on, informally, I started just picking up the phone, calling employees, calling lawyers, checking in on them, and it might have seemed weird having the CEO call you and say, hey, how are you doing? But the number of conversations I had where people opened up about their struggles and their concerns was the most I've ever heard in my career. And I shared my struggles and concerns with them as well. And it created a much more open workplace where we can talk about that, where we can feel more free to discuss those. One of my law partners, Maria Montoya Chavez, who everybody likes a whole lot more than me, and they would much rather hear from her than me. She picked up that mantle and started carrying that forward. And she became the person that really was communicating with our employees and checking on them, because they really wanted to hear from her, not me. She's much funnier than I am. And she's continued that again today, even as we're back in the office. She's really taken it upon herself to continue to check in on people just on a casual basis. And then we started to formalize our connectivity between the people in our firm. We did the happy hours. That's not for everyone, but it helped for a lot of people. And we did them on Zoom, which it's weird, but we had to do it. And then we started an official game night within the firm, which we were doing with scavenger hunts and different trivia questions on Zoom. And what I found with those was that it was much less the program that mattered, but the fact that people were seeing their friends from work and talking to them and talking about their children and grandchildren and their dogs and cats. And that's what mattered. And that was something that I think just helped people keep connected as we went forward. And I learned another valuable lesson last week, which was I had another younger employee that had not been coming into the office as much. And again, we're being flexible, especially as we're having a bit of a surge in COVID cases. And I just wanted to check to make sure he wasn't disengaged. So I took him to lunch, which was amazing because we actually got to go to lunch again. And at lunch, we started talking. We had a great conversation. And this is a young man in his 20s, and he had such words of wisdom for me that I wrote him down. And he said, look, Ben, we lost a year and a half of connecting, of bonding, of learning and getting to know our coworkers. I mean, a lot of us that are newer, we only know certain people in the firm through email assignments or, something you may hear about the person. And we don't know our coworkers the way you would expect when you're building a team, when you're building a culture in your workplace. We've all lost 18 months of building that culture. And he used a word that really resonated with me. And in our profession, he says, we don't have the trust in our coworkers that you would have after 18 months because we haven't connected with them. And so he was asking me to continue our efforts of keeping people connected and bringing people together in more ways than just the workplace, just the work assignments. And so we're actually actively working on that. Our marketing director and I are already talking about ways that we can continue that forward, because he's right. We lost a lot. We lost a lot in those 18 months. And a lot of that is the core and the culture of our companies. And we have to be cognizant of that. And going forward, I would just encourage everyone on this Zoom call to think about the lessons you learned during COVID, bringing them forward even as you come back into the workplace, because we're not out of the woods. Just because we may start to be physically back, that doesn't mean that the challenges that faced us and our employees in the last 18 months magically go away. I think for the foreseeable future, we have to continue to implement these communication tactics and ways to really bring up the morale and bring our companies together. And I thank you for your time, and I thank you guys for listening to me.
Gosh, Ben, that was great. I'm so glad you brought up the game nights, which people who know me know I don't like to. I can't sit still long enough to play games, but and I know that Alex Schnecknader, if I'm saying that correctly, was part of that and part of helping us put this together and have Sutton Thayer and Brown involved in this conversation. But I really like hearing about picking up the phone. I know for a while during when we were initially sent home, you know, I was emailing and Zoom meetings, and then it does make a big difference to pick up the phone and have a one-on-one conversation. And so I think when we were preparing for this, you mentioned that maybe employees are feeling a little more comfortable about stopping by your office, or another trusted person in leadership there. Has that helped with that interaction individually in the office?
Absolutely, absolutely. And as you mentioned earlier, the idea of breaking down the concept of stigma, of talking about our struggles, I think we're all breaking that down. And I think it's that communication. I think that communication coming from the top down really lets people be more honest. And we can't help each other if we're not honest with each other. That's
such a great point. Do you think you'll continue doing the things like game night or things like that, and while you're all back in the office again? Do you see that going into like a virtual Zoom event to continue those activities, or maybe continue them in person?
I was just going to say, I'm really hoping we can do them in person. I know we all have Zoom fatigue, but I think to the extent we can't, yes, I think so.
Okay. All right, great. Thank you for that input. Again, don't forget, you can put questions in the chat. We'll be looking for those. Taylor, next slide, please. All right, so it's my honor to introduce Nathan Cogburn, who is the Vice President of Network Development for Western Sky Community Care. Nathan is also on our board, has chaired our Heart Walk for how many years, Nathan?
I think three
or four, and just a really great organization to work with us. And I'm excited for Nathan to share some of the things that they are doing at Western Sky, and one of them even related back to our Heart Walk that we had in June. So Nathan, go ahead.
Absolutely. Thank you, everyone, for joining this important discussion. And thanks, Ben, for your kicking that off. I think you had some great points, and I'll try not to overlap a lot. There's a lot of best practices you shared there. So at Western Sky, we are a managed care organization, and we really focus on Medicaid and Medicare within New Mexico. And so when we're looking at, like you've heard from others, we all left the office about 1.5 years ago. I want to say it was last March, if I remember correctly. And that was greeted by different ways by a lot of different people. Some were elated, some were terrified, some were dreading it. And we've all heard the stories of people working off their kitchen counters, which I did for or their dining room tables, which I did for a while. Then I moved into a formal living room. My wife kicked me out of that, and so we converted the one of the spare bedrooms into my office, and that's where you see me now. So there's been a lot of change over the last 1.5 years. At Western Sky, we are still working remote. The office is open if someone has to go in to use the scanner or something like that, but we're all still remote. And we have been looking at going back to in person for the last almost year, since about this time last year, when we thought cases were starting to dip, and so we started looking at it, and of course we've pushed it off. We were looking at coming back this September, and that has since pushed back. And I want to share for a little bit, for a few minutes, kind of why we have been, so fluid. That's the word that I'm going to use for really our approach for this, has been fluid. We have a leadership meeting every 1 to 2 weeks, depending on what is warranted. And in that, we actually look at a dashboard that some of our IT has put together that looks at a number of cases for risk levels, such as cases per thousand, positivity results, ICU bed capacity, vaccination rates for the counties where our office is. And then, of course, any local direction. Sherry kicked off by saying that we just got some new direction yesterday for masks for indoors. So we're really looking at that, and we're being very fluid and trying to be very responsive based on really what that environment is, for our return to office. And like I mentioned before, we've had several dates that we've set, and then for whatever reasons, risk levels or whatever, those have moved. So that's one of the things that we've really done to, try to make sure we're accommodating our employees and really taking a very conservative approach. Some of the things that we're doing is we have gone and we've retrofitted, someone mentioned it earlier, with plexiglass. We have a low cubicle office area, so we have plexiglass going up a little high. We reduced our capacity. We were able to have enough empty cubes to kind of what we're calling checkerboard our cubes, so that we have some of that social distance. So when we come back to the office, and one of the things I thought was interesting, I went in there to go do some stuff a while back ago, and we have stairs that are designated upstairs or downstairs, again, to really help with some of that social distancing. The other thing that we've really done is we've really tried to stay close to our employees. Ben talked about how sometimes it's difficult, so you can't just walk over to someone or do something in the office, and that's been a huge change. One of my main leadership tools is, I believe it was in an HP book, managing by walking around. That's kind of been my routine for most of my career is, in the morning, going with the coffee, checking in on people, doing some of the rounding and or in the afternoon. And that's been very difficult to maintain that connection. So we've done what everyone else has talked about with some virtual happy hours, game nights, just to really try to address people as people. One of the things that we did, especially when we were looking at returning to office, is we've actually sent out two surveys to our employees of saying, what is it that, where are you? What would make you more comfortable? What are some of the steps? And we've really taken a lot of that feedback and used that to craft really what our return to office looks like. And one of those is really looking at some of the hybrid models. You heard mentioned before, there are people who have childcare issues. You have people with elder care issues that in the past, in most, businesses, like, well, you got to figure that out. And, really, we're really focusing on that as we're doing our return to office. And I'll talk about that here in a minute, of really taking some of those hybrid work situations into account and really having some of that flexibility. Currently, really our plan for return to office, once that happens, and right now that's slated for October 13th, but with the surge we're having, again, we're going to evaluate that on a regular basis, is coming back in 3 phases. And the first one would be the leadership, and then the executive leadership, and then the next phase is the really kind of our managers, and then really starting to phase our workers back into the office as well. And that's for a few reasons. One is, there's a book, leaders eat last, and so we're not going to expect our teams to do something we're not going to do ourselves. And the other part is to just make sure everything's ready, make sure that there's nothing that we haven't thought about that we need to do as we prepare to bring the whole team back. The other thing that we've done, and Sherry mentioned this earlier, is we've really looked at some pre-come back to office to really get people into, and this goes back to the mental health. A lot of us have been isolated for the last year and a half, and some people haven't seen people outside of their homes or a very small scope of people. And what I found is I've tried to engage some of our employees is, is that that's almost kind of created some anxiety, with some of our people, forget coming back to the office, but some of it's just interacting with other people on face-to-face. It's something we're going to have to really overcome. So one of the things that we have done is we've really done some socially distanced in-person events. And one of the examples that Sherry's referring to is we're very involved in American Heart Association's Heart Walk. So it was virtual last year. It was virtual this year. We were hoping to do in person, but that didn't happen. So we'll hope that for next year. But what we did is we did our own heart walk that was outside of the office. It was socially distanced, and we had mapped out about a mile-long course that we happened to be close to a park. So that worked out really well, and it was amazing. We had about 30, 35 people attend. Again, that's out of 280, give or take. So still a fairly low turnout of people who just chose to be in person. But I saw people that I haven't seen in the last year and a half, and it felt really good. And as we have more of those events of just getting people used to, getting our employees used to being, out and with their employees and stuff, I really believe we're going to see that going up. I think that is really, I think the only other thing I wanted to talk about is we're referring to return to office, but as being a managed care organization, we're really also focused very heavily on the mental health of our communities. And so with our members, we're really doing a lot of things to really expand those services to our members. Some of the examples is telehealth. We've seen about a 600% increase in telehealth visits, and we've really been promoting that. We've been sending communication out to really try to, especially for mental health, behavioral health, to really try to break down some of that isolation and really get people the help they need, whether it be crisis or whether it be just someone to talk to, so that we don't go into a crisis mode. So I think that is all that I had as far as the overview, and I don't know if we have any other discussions or questions on that.
Oops, this is a quiet group. I'm not seeing any chats yet, but we may get there. Thank you again, Nathan. And, I'm seeing these are some of the words that I'm hearing that are resonating: communication and how important that is, up, down, and across. And, Ben mentioned it, and Elaine mentioned over communicating. And so I am wondering, did you get any pushback on that? We all talk about Zoom fatigue, but did you get any pushback on the over communication?
No, haven't heard anything on the over communication. I think that's one of the things that is difficult to do, is the over communication. And, what we've really found is maybe just the opposite of, there are times that we felt we were communicating adequately and maybe over communicating, and some of the employees still didn't feel that we were communicating enough. So that's one of the things that we found is we really haven't found it possible to over communicate. And, we found that sometimes what we think is over communicating is not enough. So we've even ramped up some of those efforts.
Yeah, okay, that's great. So communication, fluid, staying fluid, flexible, and also demonstrating that, actually walking that talk is something else that I heard. And then we're going to take the comment from, I think that's so interesting with one of your younger, newer employees, is trust. And I really, again, I hear the challenges with organizations that you've got people who work through COVID, they're tired, we're tired, and then we have employees coming back or new employees that were working remotely, and maybe there is that they do have to learn to trust each other. And a lot of times what you can't measure what you don't see for some people, so they didn't see those coworkers working alongside them. And I think it's building trust is so important as well. I'm going to share a quick little story about walking around, Nathan, since you mentioned that. So I know the conversationalists know this individual, Edward Lujan, from the Manuel Lujan agencies, and wonderful, wonderful leader in our community. But I don't know I know many of the other people that are on this call probably know Mr. Lujan as well, but he had a reputation, I know you do, Paul, and he had a reputation for the minute he hit the front door, he would stop and talk to every single employee at every desk Some days it would take him an hour and a half to finally make it back to his desk. But that just always resonated with me and really speaks to what I'm hearing you all are doing in a different kind of format and really carrying on that tradition. And I know that it does make a big deal. So thank you for sharing that. And so now, next slide, Taylor, please. Now I'd like to introduce Jolu Trujillo Otillo, and she's Vice President of Business Development for Delta Dental of New Mexico. Delta Dental is our Life is Why sponsor. They are very connected to American Heart and issues concerning oral health. Of course, a lot of people don't know how connected oral health is to heart healthy, as well as involved in our youth market and helping our children understand the importance of exercise and CPR, learning CPR and things like that. And Jolu also serves on our board. So Jolu.
Thank you, Sherry. Thanks so much for having this conversation. Mine is going to focus just a little bit more on why mental health should be our highest priority right now. But our relationship, like Sherry had said, with the Heart Association is very important to Delta Dental. There's a significant connection between cardiovascular health and oral health. And Delta Dental has a significant focus on ensuring access to care for all of New Mexicans. And so the Heart Association has really helped us to be able to spread that message. I'll just talk very briefly about, because I think that two gentlemen before have really covered a lot of the challenges that we had seen. But like most companies, we transitioned our employees last March to full remote work. And that is not something that anyone in our company had done previously. I think when we packed up, we all packed our backpacks and stuffed everything and got home and thought we would have time to work on projects that had been pushed back for other priorities. And what we found was we were working longer days, longer hours. And if it didn't have COVID in the title, we didn't have time to address it. And so there was, it was a long time, I think, before we got cadence where we could really more effectively check in on our teams, because we were on calls for 8 or 10 hours a day. But I think that our team really stepped up to the challenge and performed the same high quality work that we saw from them pre-pandemic. But the transition was bumpy, as it was for all companies, in that we were home for a while. We went through a move during this period of time, an office move. We've been in a previous building for over 20 years. And so it was challenging, wouldn't necessarily recommend it, but we did get through it. And so we had sort of fits and starts in office versus home, and then kind of hybrid where we had some folks in. And so it was transitioning back to the full in office didn't occur until about July this year. And then we fell back to a partial hybrid model. And so what we found is the flexibility really is important. Everybody is feeling some stress right now. It's not just the pandemic. There's politics and climate change and wildfires, the economy, Haiti, Afghanistan, the Delta variant, less than optimal staffing levels, childcare issues. And so it's felt by everybody. But the National Center for Health Statistics interestingly found that it was 18 to 39-year-olds that report the highest levels of anxiety and depression. Anxiety, a little worry from time to time is normal in any given time. But if you feel like you're always worrying, even when everything is going fine, you may have some kind of anxiety disorder. Current research estimates that there's a 3-fold increase in anxiety at minimum since the pandemic had started. And worry that starts causing lack of sleep, panic attacks, social anxiety are very difficult to combat by yourself. So when anxiety doesn't go away, it begins to interfere with daily life in many ways. It can impair decision-making, affect your day-to-day activities, impact your work, or even keep you from connecting with your friends and family. And we know that there were issues of depression. Feeling sad again, occasionally, is just part of life. But for people with depression, these feelings start to interfere with daily living, their work, friendships and self-care start to suffer. And sadness is just one symptom of depression, but there's many others. You just enjoy things the way you did, or activities that you used to just become less fun. If you felt empty or had trouble concentrating or making decisions, you're fatigued even after you sleep well, you recognize that depression really is a whole body illness. It involves your body, your mood, your thoughts, and it affects the way we eat and sleep. It can also affect the way we feel about ourselves. And it's not the same as being unhappy or being blue. It's not a personal weakness or a condition that can be willed away. When you have depression, you can't just pull yourself together and get better. Treatment is often needed, and many times it's crucial to our recovery. You may think that asking for help is a sign of weakness, or your employees will be reticent, but we know that taking action to make your life better takes a lot of courage, and talking about a trauma is difficult, but it makes a significant difference in how we move forward. There was an Harvard Business Review podcast on hybrid work. It's here to stay, and now what? So even when companies are working their very best to do the right thing, we all juggle with a little bit of things get a little bit clumsy. We're under great pressure to share a strategy with our employees so that they can figure out how to plan their work life and their home life. And we keep bouncing back and forth depending on what the conditions are, what the state requirements are, what we feel like is the safest trajectory for our staffs. Hybrid definitely balances the benefit of being in person and working quietly at home with no commute. On average, the study found that employees were 5% more productive and a lot happier with a hybrid schedule, as long as they knew what that looked like and could sort of count on it being something that they didn't have to drop and plan to be in unexpectedly or home unexpectedly. So companies try to provide the best cohesive planning that they can, the number of days for remote work, which days. Some companies will have more decentralized options where employees can make the decisions, and some have team manage their own schedules. So, but employees are generally really looking for the least amount of confusion involved in what that overall decision looks like. So there's a challenge because it's easy to sort of inadvertently create an in and out dynamic. So if you're having a meeting and you have some employees in and some at home, this study had said it's really better to always keep have all employees, whether they're home or at work, online on the meeting, so that you get away a little bit from that in-out dynamic where there's kind of the meeting after the meeting where the folks that are at home feel left out of a part of that. And when we're hiring new candidates, they really want to see specifics about what the hybrid policy looks like. They don't want anything fuzzy around that conversation because it can lead to disappointment. And then there's sort of the diversity crisis in terms of the people that choose to come in the office versus the people that want to stay home. It's not completely random. Women typically are more likely to want to work from home. And those people who don't have childcare or having childcare struggles, or that have a longer commute, or that just have some other issue that makes in-office work challenging right now. So those working from home do face a potential working from home penalty. It certainly is never deliberate, but it's been measured that their promotion rates are a little bit lower because when they're not around to be heard, seen, and advocate for themselves, sometimes they'll get overlooked. And so companies have to be very careful to ensure that this doesn't occur. And companies are a little bit reticent to share all of the details of their plan because we know it changes. We look at what happened this week. I think that we've had our third person employee in our office today who had children in school where there are COVID cases. And so those schools are trying to figure out what they're going to do. Are they going to take a week? Are they going to wait until all of the vaccinations have occurred? And each school has got a slightly different plan. So again, parents are left trying to adapt to a moving target, and then companies have to be prepared to pivot to whatever that looks like. So I think that it's just important that teams see parity. We want sort of when we're managing, I think as leaders, if you're looking at input versus output management, you almost have to be focused on output because you really can't see what people are doing during the day. So you have to look at what they're producing and be very clear with what expectations are so that there isn't disappointment on either end. And mental health, again, is a challenge, not a weakness for all of us, whether it's using your own sensitivity to empathize with your clients or your anxiety levels to be a more thoughtful boss or employee, or your need just to forge a new path for what this looks like for your company. When we acknowledge our mental health, we get to know ourselves better. And I think it makes us more authentic employees or people and leaders. Being open about this at work leads to better performance and employee retention and better well-being. There was a large-scale workplace study conducted in very early 2021. So this is sort of what we would consider now probably mid-pandemic. And it said less than a third of people with mental health issues are getting the help that they need. Less than a third. And that's largely because of the stigma that's attached. So failure to acknowledge an employee's mental health hurts productivity and professional relationships. And the cost of this, the study had indicated was, and this is a large gap, but somewhere between 17 and $44 billion a year is lost to depression alone in terms of the focus that folks have and what it means to a company and what it means to that employee. So there is a $4 return on every $1 spent for caring for people's mental health. So the workplace culture needs to change. We all need to recognize that neurological and emotional diversity in all of its forms and workplace culture has to make room for a wide range of emotions and experience. And employers have to be more sensitive and open-minded. I think we have to treat this like we treat surgery or caring for an elderly parent. And Deloitte Global in 2020, so this was right before pre-COVID, it had launched in January, did a 2020 millennial study, and it connected with more than 27,000 millennials and Gen Zs around the globe. And the data was consistent from country to country. It was very interesting and revealed that nearly half of both Gen Zs and millennials ranked their mental health as their first or second priority in life, with only physical health ranking higher on the priority. And almost 50%, 48, reported that they were feeling anxious or stressed out all or most of the time. I just found that staggering. So with a higher proportion among women and young parents. And again, you think about last week with everything that we had heard in the news going on, and then you couple that with issues and concerns at work. So what do we do to encourage employees to take charge of their own mental health? We want them to feel more empowered. We want to encourage each other to take care of yourself. It's important to set boundaries and take focused time to recharge, walk your dog, go work out, read a book. Disconnecting is very important, even if it's for a very short time. That always on culture, I think, leaves us with the impression that we have to be thinking about what we're going to do next at all times. We're bombarded with reminders and expectations. We have a lot of distractions that start to fuel anxiety. And so stepping away from computers and phones, even if it's just for a little bit, helps us be more present and get our thoughts more focused. And being kind to yourself. There's always that reason that airlines tell you to put your own mask on first. It's hard to take care of anybody else if you can't take care of yourself. And then help your employees build courage to fight the stigma. More than half of the respondents of a national survey by Paychecks said that people were uncomfortable talking to their managers about mental health. And so you have to have honest conversations about workloads as you're talking to your employees, their stress levels and other mental health concerns, and help them understand it's not a weakness. Share your own experience. I really liked when Ben talked about when he was at lunch and sharing his own experiences with his employee. I think it makes us all feel much more human, like we're not in this alone. So it helps prevent burnout. And interesting for those of you with kids at home still, there was a large international study that screen time should be replaced by green time for optimizing well-being. And this was a professor at biostatistics and epidemiology in Australia. And the advice was from, it surveyed more than 500,000 13 to 15-year-olds, or I'm sorry, 11 to 15-year-olds, I believe, in 42 countries, including North America. And it said that boys that spent 90 minutes a day or girls that spent an hour a day on their screens, includes TVs, cell phones, any other devices, were more likely to feel sad about their lives. And the survey found that the more screen time they logged, the worse they tended to feel. So the good news that came out of that was that the more time that they spent then actively engaged outside, it was a very quick turnaround in how they could begin to feel better, healthier, stronger, and more satisfied. And based on the findings, the professor was calling on parents to set that example for their kids, be outside with them, and create technology-free zones. And one of the last things I just wanted to comment on, I think that is really important, and since we have Nathan talking about what your company had done, EAP programs, the employee assistance programs, I think are a really important benefit. It's up to company leadership to ensure that employees are aware of these services. We know that they can offer professional counselors to provide assistance for emotional or stress-related issues. Some offer other kinds of help, financial consultation, legal consultation, but making your employees aware of those services. I was talking to a few folks here in our office, and they were not aware of what the program offered. So it's up to us to do a better job. So I think that the one thing that Forbes magazine in June of this year had said that 1 in 5 people, what Sherry had said earlier, will experience a mental health issue in their lifetime. And now it's probably higher than that due to the pandemic. So for CEOs, this is the thing that should be keeping us all up at night, is how do we do this to better help our employees, to communicate more, to help them understand that we have their back, to make sure that they understand what the resources are that are available, and to just be kind to yourself, be kind to others, ask for help when you need it, and offer help for those that you see struggling. So that's it.
Awesome. Thank you, Jolu. I really like hearing those statistics. The company examples are awesome too, combined with those statistics. But my takeaway is 2 more important words that you used: understanding and parity. I'm shocked at that statistic about 18 to 39-year-olds, because I have a good friend on this call, Martha Carpenter. Many of you may know Martha. We have always said that we wish we had worried more about our lives when we were 18 to 39. So that's an interesting, I don't know if we were an anomaly or if that's an interesting shift, but again, thank you for sharing that. You brought up some statistics that I've been wondering about too. And I'm wondering how for each of you, oops, let me get myself back. Hold on. So I was having stress because I have a fly in the house and it was driving me nuts, and I fidget and it was making me fidget more. So that was causing me stress. I don't know why. Maybe the fly isn't letting me show myself. But so I'm wondering, are you at the crossroads yet of helping and understanding and listening to your employees, your leadership, your employees, to where you're now measuring, or do you feel like you have to also keep measuring productivity? Because, Jolu, you mentioned that. So I think you said that one of the studies showed 5% more productivity, 4 or 5% more with people being allowed to work from home. Anybody else in your organization at that crossroads or thinking about that?
I think that people really are looking for clarity to understand what the expectation is, and they'll largely deliver if they know what the expectation is. I think that the more nebulous things become, the harder it is to manage that, and the more difficult it is for the employee to really know what they're supposed to be delivering on their end. We measure it honestly in the same way we have before. When we had mid-year conversations with our team, we just asked them, what are one of the most important questions I think that we ask is, what are the barriers for you to be able to do your job well? And so we got some very good insight, I think. And it's different for every company.
Awesome.
So, yeah.
We're about nearing our wrap-up time. Any other input from any of the conversationalists? Gosh, I have really gleaned a lot, and I'm reading the comments. I hope you all are seeing the comments in the chat. People are True Health New Mexico sharing, some of the ideas that they've done. Some other comments in there, really great accolades for each of you as conversationalists. And I hope that every one of you will, I know you'll take takeaways from this. We'll make this recording available and send it out afterwards if you want to, relate back to it or share it with a board or something like that. And we'll continue doing community wellness chats on mental wellness, again, sponsored by Bank of America Merrill. We just couldn't do these without the funding and support. I want to thank Alex for helping Ben and I and behind the scenes, and Nikki Mitchell with Bank of America. And then also I'm supported by a wonderful team out of our Austin office. And that would be Taylor and Caroline, who are on this call and really make everything that we do more professional and more seamless. But most importantly, thank you all for listening. I think it's a strong topic we can keep talking about. And anybody have a last minute question or anything they want us to address? I see a lot of thank you. So that sounds like you've covered a lot. And again, thank you again for joining us. I